We were expecting a baby in August of last year, and last May we found out that there were some complications during one of the routine scans. There was a problem with blood flow, so the doctors were a little worried that we could end up in a situation where we have a preterm baby.
We call a baby a premature if they are born less than 37 completed weeks. We classify them as extremely preterm babies when they are born less than 30 weeks. If they're born between 30 to 34 weeks, we classify them as a preterm babies, and if they're born between 34 to 36 weeks, we call them as late preterm babies. And it's always quite challenging for the doctor and for the baby and the parents in the care of newborn.
It just happened, we came for 2 consultations, and the 3rd consultation it was like my water broke and we had to come for get into labor.
We start our support by taking them to the neonatal intensive care and showing them around and meeting the nurses and the doctors. This helps them develop a rapport with the nurses and the doctors. It also makes them very comfortable because they know where the baby is going to be and what kind of support that the baby is going to get.
It was very devastating. The first 2-3 days it was like our whole world shattered, because seeing a baby with such a low weight and all wired up and geared up and you don't know what's happening.
Motherhood certainly does have a whole army of experts who really ease you into motherhood. They make you more confident, they make you equipped with the skills that a new mother really needs to take care of the baby.
All the nurses, they had a lot of dedication and hard work and support. They were 24/7 available, and I used to call them in the mid of the night around 3 o'clock and just ask them how my daughter's doing. And they would just reply back, "Ma'am, we are all there to take care of the little one."
When they are born, we look at their maturity, we assess them what exactly they need. Is the lung premature? Is heart needs some special care? Or if their brain needs any special care? And we look at every aspect of the baby, including nutrition of the baby, the electrolyte balance of the baby, and we try to find out every bit of it, and we are like kind of glued to the baby.
He weighed only 2.4 and he was such a small child. He was like a small rabbit.
I was given a kangaroo treatment where you can touch your baby, you can feel your baby. At that moment I was very perplexed, oh my God, so tiny baby, how I could handle him. And after a few days I could see the improvements in his health.
Isan is now 17 months old. We've seen him from the time he was born till now, and there's such massive changes. It's very hard to believe that this is, a baby that we were so worried about. He is extremely active, very vocal, very sharp, and very naughty. So he keeps us all on our toes. I think I should owe all my weight loss after the pregnancy to my son.
And now she's very normal, she's very hyperactive and doing good in her, whatever skills, drawings or coloring, and she's interested in everything, and she's doing really good.
We at Motherhood have a wonderful team dedicated and completely in the care of newborn. We have a state-of-art 11-bedded NICU with all the latest equipments and infrastructure, and with that we have well-equipped doctors who are there with the babies all the time.
I think there are a few things you have to keep in mind, and I know we live in a society where everybody is going to tell us what's best for the baby, parents, in-laws, older sisters, brothers. Just listen to your doctor, because the doctors have been through this over many cases. They know what's good for you, what's good for your baby, and they will tailor make their advice for your condition.
Sometimes parents who have been through this journey and this experience are better off talking to the parents who have their babies currently in the neonatal unit. It's sometimes better for them to talk than us as professionals involved. So we introduce, and we have many parents who have come forward to talk to these parents who have their babies currently in the neonatal intensive care. They are better able to express and tell the parents of how to cope with the situation. I would like to assure you that they are in the safe hands of Motherhood Hospital, which will not only provide support and care for the preterm babies, but also will support the parents through their journey through this hospital.